We wanted to share the model of ACES, the Inpatient Addiction Consult and Education Service, some of our early successes and also the challenges that we face here at UK. And there's addiction medicine consult services around the country, but most are in sort of urban centers, and we're really here at the urban-rural frontier, which poses sort of unique challenges. I think those challenges fall into three major buckets. One is the volume. We see a ton of patients coming into UK Chandler Hospital and Good Samaritan Hospital struggling with complications stemming from their opioid use disorder.
We regularly have a census of 40 to 60 patients a day, which I think really demonstrates the need. And we've gotten a lot of positive feedback from our colleagues that they feel it really helps support both the patient and the other medical teams in providing evidence-based treatment for substance use disorders in the inpatient setting. What became more and more clear was that people with these severe complications weren't getting evidence-based treatment for the underlying reason that they were hospitalized. If they had an injection-related infection due to opioid use disorder, and they would receive medical treatment for the severe infection, sometimes really advanced surgeries. But then the underlying reason for the infection, the opioid use disorder, was not addressed.
We have quite a few patients in our hospital who are admitted for a lot of reasons not related to their substance use disorder, but perhaps the substance use disorder is what caused or contributed to the infection, if you will. And once these patients are in the hospital setting, many of them are with us for a very long time. And so our nurses really need to understand the disease process. They need to understand the evidence and how medications can be used to treat the disease, and really need to learn more about it so that they can think about substance use as another disease that our patients are struggling with.
You know, unfortunately, during the pandemic, we're seeing a lot of fear among individuals who are struggling with substance use disorder. There's a fear that if they come in, they're not going to be adequately treated. There's fear of sort of an unsafe and uncertain supply of the drug that they are using, and the risk of overdose that comes with it as well. And I think what we do with ACES is provide a lot of hope for those patients to counteract the fear that they're dealing with. We provide hope that we can get them into treatment. We can start them on appropriate evidence-based medicines, and they can get better.
I think there's a lot of evidence that shows us how important consult services are and how they can lead to better outcomes for our patients. So I think it's important that we share the work that we've done, and it's a multidisciplinary team. It is made up of physicians and nurse practitioners, and we have a nurse navigator as well as a clinical social worker, and then also we have a peer support specialist.
Once they've started on evidence-based treatment for opioid use disorder, in particular medications for opioid use disorder like methadone or buprenorphine, there's additional work in linking patients to continued treatment in the community. And at UK, we're particularly fortunate that we were able to launch the first Bridge Clinic in 2018, which was presented at the RX Summit a couple of years ago. They can go to the first Bridge Clinic after discharge and be stabilized, and then we can work over time to find them a treatment home closer to where they may live. I'm very proud of our team and what we've done over a relatively short period of time.
So what I'm most excited about with the RX Summit is listening to some of the other presenters to see what opportunities they're creating for patients. Whether it's government, whether it's law enforcement, whether it's other community organizations, faith groups as well. I want to see what doors are being opened for our patients, what doors are being closed, and how we as a service can learn from that and make sure that we're linking our patients to those appropriate resources in their own community.
So my purpose of attending the summit is really to learn so that I can better support our nurses, so I can think of ideas that we may be able to implement here at UK Healthcare. I have a brother who has long suffered with a substance use disorder. So I see his story and I see his life in the lives of some of these patients. I feel both a personal responsibility, but also as a nurse leader, really in a responsibility to help our nurses take the best care of patients that they can.